Welcome my friends, I'm Bob Schrupp, physical therapist. Today we're going to talk about vertigo or dizziness. That's that spinning that you might be feeling when you move your head in a certain position. And we're going to talk about a certain treatment that you can do for that dizziness. It's actually the most common treatment, the most common helpful treatment for vertigo. Vertigo, the most common cause of it is when you have debris that is in the semicircular canals that are in your ear. And there's 3 semicircular canals, and the most common place for the debris to end up is in the posterior canal. So this treatment is for that. It is the most common one. And generally what the type of person that's going to be, this treatment is going to be appropriate for is if you're the type of person that, today we're going to talk about going to the left. So if whenever you turn your head to the left or roll to the left, that's when you feel the symptoms. That's when you feel the spinning or your eyes are, shifting back and forth. You may even have kind of a loss of balance for quite a while after that. The whole thing with this though is, the one that this in particular is going to help you with is if you turn your head to the left and the spinning goes away after less than a minute. If it's more than a minute, it may be something else. If it's way more than a minute, like an hour, then it's completely something else. Of course, you need to see the doctor, and you may want to see the doctor anyway. This is just a general suggestion of what you may want to look at. So today we're going to do the left Epley Maneuver or the left Canalith Repositioning Technique or left Canalith Repositioning Maneuver. They're all the same thing, and they're designed to move that debris into an area where it's no longer going to give you trouble. This helps probably about 85% of the people, and it may have to be redone, maybe more than once, maybe another day or a couple of days later or a couple of weeks later. But it is quite effective when it is for that particular diagnosis. Now, before you do this, you want to make sure that you're going to have a bed or do this on the floor. I guess I'm going to use a pillow today rather than going my head off the edge of the bed. But you do want to make sure you have your neck, that you can extend it back and that you can turn it at least 45 degrees. I mean, if you have really severe arthritis or problems with your neck, this is not something for you to try. The other thing is, before you do this technique, I want you to understand what 45 degrees is, because I'm going to be asking you to move your neck into that position. When I'm straight ahead here, that's 0 degrees. When I'm way over to here, to the right, that's 90 degrees. So halfway in between 0 and 90 is 45. So this is a 45-degree angle to the right, and here's 0 and 90, so halfway in between to the left is 45 degrees. So you're going to start off, and with each one of these positions that you move into, I want you to hold the position until the symptoms go away, or at least 20 seconds. Alright, so you're going to start off in a seated position, what we call a long leg seated position here, and you're going to turn your head. Now again, I'm assuming that you're having symptoms to the left. So we're going to start off with turning your head 45 degrees to the left. And then you're going to bring your head down, and when you're on this pillow, it's actually extending your head 20 degrees. In other words, your head's tilted back just a little bit. I've still got the 45-degree angle, I got the 20 degrees. You should keep your eyes open. I'm just going to turn this way right now. You make sure you keep your eyes open during the entire position, during this whole maneuver. So again, you're starting off 45 degrees to the left, you're going down, head slightly extended 20 degrees, hold for 20 seconds or until the symptoms go away, whichever one comes first. And now I'm going to turn my head to the right and keep it at a 45-degree angle, and the same thing, eyes open, looking for symptoms to last for 20 seconds or less. Then now I'm going to turn over onto my right shoulder. And as I turn onto my right shoulder, I'm going to look down 45 degrees. Same thing, looking for symptoms to last less than 20 seconds, or I'm going to stop after 20 seconds. And then I'm going to go ahead and just sit up, keeping my head upright. Now, it used to be taught that you were supposed to keep your head upright actually for 24 to 48 hours after this. We used to have people wear a soft collar. What we're recommending now is that you keep your head upright for the rest of the day. You may want to wear a soft collar just as a reminder so that you don't look down. You don't want to do any turning or looking down. down in this region here. And I would recommend that at night, especially if you're having symptoms to the left, I would not sleep on your left side, and I would sleep with a couple pillows under your head. So you're kind of a little upright for the night. And you could even do that for a couple nights. And hopefully this will take your symptoms away. Good luck.